Stay on the goddamn path and be careful, because if you start to mess around and you deviate, especially if you know that you're deviating, things are not going to go well for you. And that idea is everywhere. And I think it's right. I think the idea is right, because there aren't that many ways of doing things right, and there's a lot of ways of doing things wrong. And if you do things wrong, the consequences of doing them wrong can be truly catastrophic.
You know, when you hear about procurement professionals being reshuffled here and there, or being vetted, you know, you actually think about the tender process. Sindio. But I have an interesting video, okay, of something which happened last year, Kericho County. Let's have a look and then we talk.
Governor The institution said it was sad to see the facility had stocked only 3 types of drugs and ordered for replenishment.
The patients that comes here, and many times they don't have much money themselves. That is why they are here. They would have gone to the private facilities. But now when they come here and they don't get drugs here without patients, it becomes a big burden for them.
It is here where the governor ordered the chief officer procurement department at the health facility, Dr. David Ekuwam, to immediately reshuffle all staff at the department.
I've had chief pharmacists, and I want you to work on this on Ekuwam, that there are some cartels in the hospital facility here, in the procurement offices here, that they procure drugs, and then without knowledge of authorities, they sell drugs outside here. I know pharmacies here in town that are selling CHOK medicine, and I'm warning those pharmacies, tukikuja kwa pharmacy yako, and you are selling CHOK medicine, we'll come and ask you, where did you get these drugs from?
It reaches a point, you feel like there is no need of talking about these issues. I don't know if there's any point. Maybe for you out there, you've seen this or not seen this, and you actually feel like the procurement practitioners are at fault. But I have a question. Yes, you can actually know the inventory levels, you know, that you actually need per drug. You can know the price. You can know where to source. Is it KEMSA or is it meds? But who knows the uptick? If, for example, you give it to this child, kutakuwa na reaction. Nani anajua regulation, like we have moved from tablets to syrup? Nani ako hapo na vitabu anaandika, I have given out this number of tablets? You know, when it comes to, if that information was now shared to procurement, and procurement did not action it, kuko na shida. But then, procurement should also be given a chance to state why they were not in a position to actually purchase those drugs. Maybe kuko na shida ya nini? But then there is something interesting that was actually mentioned. Cartels. Let's watch that video again.
The department.
I've had chief pharmacists, and I want you to work on this on Ekuwam, that there are some cartels in the hospital facility here, in the procurement offices here, that they procure drugs, and then without knowledge of authorities, they sell drugs outside here.
Maybe I'm wrong, okay? Maybe I could be biased based on my experience. Because in my experience, you can even find facilities that do not have supply chain practitioners at all. You only find we have the doki, we have like the pharmacist, or even a doctor who is actually wearing so many hats. Yendo daktari, yendo cleaner, yendo pharmacist, yendo wochi, everything. Now, we can actually assume that, yeah, when it comes to level 5 hospital, maybe this responsibility falls, you know, on the procurement. You know, but then I would actually assume that such hospitals, then we actually are working in terms of having a cross-functional process. What do I mean by cross-functional? Cross-functional. Pharmacists are communicating with supply chain have access to that data, and finance have access to that data. Because when it comes to KEMSA, then they have their system. Sindio? And for them, they actually deliver to county hospitals, and then watajua venye watasort from there. You know, when you look at, for example, the Honorable Governor stating that drugs should be available at the hospital facility. They should be. Kabisa, because watu wanatoka nyumbani, yes, wamekuja hospitali, they want to go to the pharmacy at the hospital and be given drugs. Sawa, not expensive, because what happens is drugs zinatolewa hospitali, taken to clinics, and then the price yenyewe is ×2, ×3. Now, if, for example, okay, we have officers when they source these drugs, they are brought in. Let us assume they're the ones who are actually in charge of the warehouse. Sawa. Now, what kind of lie can these people actually sell to the pharmacists and say, hizo drugs hazikukuja? Okay? What kind of lie can these guys actually tell the finance department, hey, this is like the requisition, do your quotation, do your invoice, pay. Okay? You know, the math is not mathing. But then, we never talk about this. And again, let me take you back to a specific document that talks about what people assume procurement to be all about when it comes to the Ministry of Health. Here it is. So this is the document, and let's go to the specific page that needs our attention. Now, I'm actually of the opinion that supply chain, as a strategic function, should be able to work in a cross-functional manner with all other departments. Maybe I'm wrong. Maybe I'm expecting too much. But let's look at what this document says. So, in this paragraph 2, it's starting with this sentence starting with discharge. Discharge of core supply chain functions of quantification, procurement, warehousing, and distribution has been coordinated by few departments, including pharmacists, pharmaceutical technologists, nurses, and medical laboratory technologists. Now, in my opinion, I believe procurement can only act when they have that kind of data. Hey, we need these drugs. And if they get the list, then they should be able to forward it to KEMSA. Now, if KEMSA do not have that drug, is another issue. But hey, it's my opinion. Because I'm assuming the procurement should not be able to sit on this kind of data. Umepata requisition, and then you're there saying, hey, sisi hatununui madawa zingine, tunanunua tu 3. How? You know. Now, if you recall what happened in Machakos, if we are not careful, there's going to be a repeat of this. And my question is, if all of these core functions were being done by these people, then where are the supply chain and procurement practitioners? Where are they? What happened? Someone, please comment, help us understand.